human immunologist at the Jackson Laboratory, joins us now from Farmington in Connecticut. Good to see you. So no one seems to be terribly convinced by this Russian vaccine and how effective it's going to be. What are your thoughts?
Yeah, I mean, this is simply a political stunt by Putin. There's no scientific rationale to approve of such vaccine. Because if you look at the world, I mean, there are 160 different types of vaccine are in works. About 8 of them actually have passed the phase 1, phase 2 trials, which means that they're at the same level or even more advanced than what the Russians have announced. There are several vaccines that have shown very effective results from monkeys, very effective results, phase 1, phase 2 trials, and they have been published in the scientific journals. Whereas for the Russian vaccine, there's absolutely no information, no publication, and it seems like they've done this with a very small group of about 38 people, which itself is ethically concerning because a portion of those people apparently were those who actually developed the vaccine. And Putin said, I just gave it to my daughter. These are not really acceptable norms, any scientific norms. You have to wait for the phase 3 trial, because phase 3 trial is where you're going to know if the vaccine is effective and, importantly, whether it's safe, because you have to apply it to tens of thousands of people, and they haven't even started the phase 3 trial. So it's really just to say that we were the first in the world, but it's really a pointless thing to do right now. We have to wait and see if it's really effective or not. Not to mention that this vaccine is actually almost a copy from what we understand, with very similar to the Oxford vaccine and another vaccine in the U.S. So it's basically they've just copied it. There's nothing Russian innovation on this either.
Right, but Russia is presumably assuming that this vaccine is safe because President Putin has given it to his daughter, as you've said, and they're apparently going to start mass vaccination as soon as possible. What are the pitfalls of that with a vaccine that hasn't been properly tested?
Sure. So vaccines are very different than therapeutics or drugs or medicines given for therapies. Why? Because you're giving a treatment to a patient, and that patient might die if you don't treat them. So, in fact, in the COVID-19 case, we've used drugs that we weren't really sure that they were working, but we had no choice. Whereas vaccines are given to healthy people, and not just Putin's daughter, but hundreds of millions, maybe billions of people, different age groups, different diseases, different male versus female. I mean, there's endless possibilities where you may not see a side effect. Out of 1,000 people, 999 may not show a serious side effect, but one very serious side effect is already sufficient to render the vaccine ineffective, because when you talk about hundreds of millions of people, 1 in 1,000 are many, many people. So that's why it has to be tested in tens of thousands of people to ensure, and you have to wait a certain period of time, because what is critical for a vaccine is that you may not see a side effect at the time when you make the vaccine, but when you get infected on top of a vaccination, that could be potentially a problematic situation. Not in everyone, but a few people. We don't even know that. So, and critically, very, very important, because there's already an anti-vaccine sentiment in the world. In the US, 40% of people said they will not have this vaccine. If you have any kind of a negative outcome, a side effect that's serious, that's going to make all of the vaccines, basically people will reject them. And so we have to be very careful, and not to mention those who are given the vaccine will feel safe, even if they don't know if it's really working or not. So they're not going to take the proper precautions. So maybe they will be exposed to more infections. So it's really problematic to be able to, approve a vaccine that hasn't been tested vigorously.
Some sobering thoughts there. Thank you very much indeed for that, Derya Unutmaz.